severe and long-lasting, particularly on children. So significant numbers, about 1 in 4 domestic abuse cases, families where there's domestic abuse that are on our database. The age of the child in the family is under 5. And yet, we know that families are living with domestic abuse for, on average, 2.6 years if it's high risk, 3 years if it's medium risk. That means these children are living for significant periods of their life in households where they live with fear, coercion and violence. And that's having an impact on their development and the opportunities that they have to fulfil their capacity and their potential later on in life. In addition to the long-lasting impact of the abuse on the victim, her or himself. We also know that at the point that we find families where there's domestic abuse, it is getting worse. 79% of the high-risk domestic abuse cases that we see, at the point they get help to stop the abuse, it is getting worse. It's escalating in frequency or severity. The risk is getting higher and higher. We also know that for families living with domestic abuse are expensive families. They're taking up a lot of public resources. And we, in a spirit of intervening earlier and finding families who need us more quickly, we need to find those families. The overall message, though, of course, is that finding families earlier stops murder and serious harm. I don't like doing these presentations unless I have an opportunity to bring some of the testimony of the people we've worked with into the room. So here are some words from Hannah and Maria describing why they lived with abuse, what it felt like, and why they didn't leave that relationship earlier, why they didn't get help earlier. You can see in that situation where perhaps Maria may decide that actually she can't ask for help. So perhaps we have some responsibility to spot what she's living with and to offer that help, to reassure her, to make it safe for her to disclose, to make it clear that it wouldn't be tolerated for that abuse to continue of her or of anyone else. So many victims do try to get help, but they don't get the right help. We still have far too many missed opportunities. So in the year before, victims on our database got help. 78% of them reported abuse to the police. They rang the police at least once. Almost a quarter of high-risk victims went to accident and emergency because of their injuries. Some people on our database went to A&E because of their injuries 15 times in that year and didn't get help. They got help for the physical. They didn't get help to stop the abuse. And overall, the vast majority of victims that we have spoken to or that are recorded on our database, the vast majority sought help. They sought help on average 5 times from 5 professionals in that year. Maybe they told them about the abuse, maybe they didn't, but those were opportunities that we missed to find out what was going on in that family and put something in place to try and stop that abuse. Each contact represents a chance for us to help that victim disclose and get help. We thought we wanted to dig a little bit beneath some of these figures and understand a little bit more about what service use was going on with these families. Who were they seeing? So we asked 2 areas of the country, very different areas. I can't tell you where they are, sorry, but take my word for it, they're about as different as you can get. And we mapped public service use for the 12 months before and after the MARAC meetings. These are high-risk cases, there's a lot going on in these families. So on average, these families were supported by 3 different agencies. And they had 17 contacts with professionals in this 2-year period. Most of those contacts were while the abuse was going on, rather than after they'd had help to stop it, which, it's the wrong way around. After we've spotted the abuse, that should be the point where we're ramping up the help and the support. Most commonly, it was the police who have a responsibility to spot domestic abuse or children's social care. There was more use when the primary victim, usually the mother, was younger. Unfortunately, and I know it's a pretty big gap talking to a health audience, we weren't able to get ethical permissions to get GP and hospital data to add to this. So this is excluding any of the health professionals that could have seen these families. We wouldn't expect the picture to be all that different, however. Here's what Julie says. Julie says, 2 years after my daughter was born, I gave birth to a little boy. Things continued much as before. She's describing a pattern of abuse. The police were never called, and I tried to keep things covered up for the sake of the children. I didn't know that there was any help out there, and I was too ashamed to let people know. I went to hospital a few times, but he always accompanied me, and I had to lie about my injuries. I wanted the nurses to cotton on and to help me, but no one noticed what I was going through. So, how can we find those families? That isn't an uncommon experience. You work with domestic violence victims and you hear them say, well, you know, I went to the front desk of the council and I told them about the domestic abuse and they helped me get on the housing waiting list, or they helped me get a deposit, but they didn't do anything about the ongoing abuse. They say I went to A&E, they say I had a midwife appointment, and she asked the routine question, but she didn't notice that my husband was still sat next to me, so of course I couldn't answer it. Those are the stories that we hear. So what is it that we need to do? Firstly, all agencies have to look for these families who are living with abuse. It used to be that only the police found domestic abuse. It used to be that it was only the police's responsibility to find domestic abuse. But now, it's all of our responsibility. And actually, the numbers going up, the numbers of people who aren't the police who are identifying domestic abuse are going up. And we need to keep that going. It needs to keep going up. We've still got too many families who are only getting help when the police are called. If the police are being called, that family is in crisis. And we can get in there earlier. We know that other professionals, apart from the police, may suspect what's going on, but they don't know what to do. Lots and lots of families are in contact with a variety of statutory and voluntary agencies, but they're not identified, perhaps because staff aren't trained to spot the signs, aren't confident about what they need to do, don't see it as part of their job. My job is to patch her up, perhaps. We think there's considerable potential in locating domestic abuse specialists in places like hospitals. And we've seen some really good programmes in GP surgeries and in advice agencies that really have increased identification. So the IRIS programme, which if you work in a primary care setting, do encourage GP surgeries that you work with to consider commissioning. The IRIS programme is nationally evaluated programme that puts training support in and a link programme into your local domestic violence services. They tripled identification of domestic violence on their surgeries caseload when they implemented this programme. Citizens Advice Bureaus across the country are piloting something that they call Ask, where they ask a routine question for every woman who comes in for a housing, benefit or debt problem. They were getting disclosures at a rate of less than 1%, and now they're running at 27% of their clients who are disclosing domestic abuse in places where that pilot is running. So it is possible to put in good systems and good processes that can help you increase identification. You need to do it in a structured way, and you need to think about how you make sure you're not missing groups of victims and families, perhaps through some of the stereotypes about who might experience domestic abuse. But the thing about some of these programmes is that they can reach groups of victims and families who we wouldn't otherwise identify, who won't call the police, who wouldn't present at a domestic violence service.